Genus Strongyloides. Genus Strongyloides. Strangoloids morphology. Strongyloid morphology. The adults are free living with blunt-ended with tail and an elongated straight-sided esophagus. The free living adult, the female slightly larger than the male. Both sex possess a tiny buccal capsule and cylindrical esophagus without a posterior bulb. The ovary is didelphic and open at the vulva. Both sexes have a rhabditiform esophagus, but the larvae have a piliform esophagus. These larvae have a tripartite pointed tail. Male can be distinguished from female by two structures, the spicules and gubernaculum. Strongyloids life cycle. Strongyloids life cycle. The life cycle is more complex. The parasite cycle is homogonic while the free living cycle is heterogony. In the free living cycle, rhabditiform larvae passed in the feces can either a molt twice and become infective filariform larvae by direct development. In the direct development, first stage larva L1 transform into infective larva after 3 molts or we mold for time and become free living adult male and female. By indirect development, the adult male and female mate and produce egg from which rhabditiform larvae hatch. The indirect development result first in the development of free living adult mate. The female lay eggs which hatch and then develop into infective larvae. Strongyloids life cycle. The direct development gives IL faster in 3 days, whereas the indirect route in 7 to 10 days. The indirect development result in an increase in the number of IL produced than direct development. The free living males and female die after one generation. The infective larvae either develop into a new generation of free living adult or develop into infective filariform larva. The filariform larva penetrate the human host skin to initiate the parasitic cycle. The infectious larva penetrate the skin when it contacts soil. When the larva enter the blood circulation, then reach to the lungs where they enter the alveoli. They are then coaxed up and swallowed into the gut where the parasitic and intestinal mucosa. In the small intestine, they molt twice and become adult female worm. These females are parthenogenesis, produce egg. Only female will reach reproductive adulthood in the intestine. The egg hatch in the intestine and young larvae are then excreted in the feces. It takes about 2 weeks to reach egg development to adult stage. Autoinfection. See autoinfection. The worm also participate in autoinfection, in which the rhabditiform larvae become infective filiform larvae, which penetrate either the intestinal mucosa, internal autoinfection, or the skin of the perineal area, external autoinfection. In either case, the filiform larvae may follow the previously described route, being carried successively to the lungs, the bronchial tree, the pharynx, and the small intestine, where they mature into adult. Strongyloid life cycle in human. Strongyloid clinical sign. They may cause intermittent or persistent diarrhea and constipation also. Upper abdominal burning or pain, cough, wheezing, chronic bronchitis are another clinical sign. In the skin, pruritus, urticaria, rashes may occur immediately after contact with the worm, red hives near the anus, vomiting, weight loss. Strongyloids pathogenesis. Lighter infections remain asymptomatic. Severe infections can cause dermal, pulmonary, and enteric disease. The migrating larvae under the skin causing larvae occurrence, which is characterized by urticaria, pruritus, eosinophilia, dermatitis, and inflammation. Pulmonary migration may cause a mild transient pneumonia in men with coughing, wheezing, shortness of breath, and transient pulmonary infiltrate termed as Loeffler syndrome. Loeffler syndrome. A massive infection may result in necrosis and slugging of the mucosa, hemorrhages, epigastric pain termed as mimic peptic ulcer or Crohn's disease. Crohn's disease. Vomiting, abdominal distension, diarrhea with voluminous feces, and a malabsorption syndrome with dehydration and electrolyte disturbance and arthritis. Hyperinfection when animals are in stressed or immunocompromised, resulting in colitis, 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 pneumonitis, and neurological manifestation such as meningitis and cerebellar abscesses. Larval current by strongyloids. Larval currents by strongyloids. Larva. Races caused by strongyloids. Strongyloids diagnosis. Following tests may be performed to diagnose an infection. Duodenal aspiration. During this test, after aspiration of fluid from the duodenal and fluid will examine under microscope. Septum culture. Septum culture can be performed to analyze fluid from lungs or airway for stercoralis. Examination of fecal sample for ova and parasite. Complete blood count CBC with differential. It may help to rule out the causes of clinical sign. Blood antigen test. Sorry. Strongyloids prevention and control. The best way to prevent it is proper sewage disposal and fecal management. Treatment with ivermectin can also be practiced. Module 33. Order Strongylida. Order Strongylida. Learning objective. After reading this module, the learner will understand the following: importance of strongyl infection with respect to colic in horse, pamphlegeal condition in sheep and goat, pathogenesis due to L4 larva stage in intestine, Strongylida, and introduction. The members belonging to this superfamily are known as Burchard nematodes. Family Strongylidae, Strongamidae, Strongylidae. Characters: it has a well-developed buccal capsule. A median thickening in buccal capsule is known as dorsal gutter. It possesses both external and internal leaf crown or corona radiata. Teeth or cutting plates may be present. Leaf crown resemble palisade, so it is commonly called as palisade valve. In male, the bursa is well developed. Bursal lobes are supported by modified caudal papillae known as bursal ray. Spicules are equal. Genus Strongylus. Species S. vulgaris, S. edentatus, S. equinus. Host equine. Location large intestine. Morphology of Strongylus vulgaris. Worm are smaller than other two species. Buccal capsule roughly oval in shape. Buccal capsule contain two ear-shaped dorsal teeth. Both internal and external leaf crown are present. External leaf crown freezed at distal extremity. Spicules are equal. Life cycle of Strongyloides. Egg are possessed in phases of host, oval in shape, thin cell contain early segmentation of yolk. The development and hatching of egg is controlled by various factors like moisture, temperature and O2. At 26 degrees Celsius, the first stage larvae is produced within 24 hours. Bionomics of Strongyl larvae. The L1 hatch out from the egg. L1 have reptiliform esophagus. L1 mainly feed on bacteria and grow rapidly, then enter into the lethargic state and molt to L2. L2 also feed on bacteria soon after lethargic state. The L2 molt to L3. L2 have less reptiliform esophagus. L3 have filiform esophagus. It is a infective stage. Cuticle of L2 is restrained as a protective sheath around L3, which is very important for survival of infective stage. Since L3 wrapped with cuticle or L2 is does not feed, L3 thrives on the stored food material in the intestinal cell. Infective stage is negatively geotropic and positively phototropic to mild sunlight, but it will be repelled by strong sunlight. L3 larvae crawls on grass blades in early morning, evening, and during dull weather. L3 survive up to 3 months. Excitement occurs in the small intestine of horse. After excitement, L3 penetrates the intestine wall, where L3 molt to become L4 in about 3 days of infection. These L4 penetrate the intima of submucosal arterioles and migrate towards the cranial mesenteric artery. In the cranial mesenteric artery is produced thrombus and lateral aneurysm in about 14 days of infection. From 45 days of infection onward, the L4 pass back to submucosa of cecum and colon Y arterial system. In the submucosa of cecum and colon, L4 molt to L5. Then L5 enter into the lumen of intestine and reach maturity in about 3 months. Strongylida pathogenesis. L4 in the cranial mesenteric artery causes inflammatory reaction lesion like endarteritis and thrombus formation. Due to thrombus formation, initial thickening and lateral dilation of arterial wall may occur. Sometimes the thrombus detected lead to fetal result like occlusion of coronary artery or brachiocephalic trunk. Infection of iliac artery lead to temporary lameness. Thrombus in the testicular artery result in passive congestion of one or both testicles. Diarrhea syndrome may occur and is associated with ulceration of cecum and colon due to thromboembolism caused by migrating larvae. Strongylida clinical sign. Colic is due to pressure of cranial mesenteric artery on nerve plexus. Rub cord, diminished appetite, diarrhea, edematous swelling on the abdominal and leg, emaciation and anemia. Adult worm caused heavy blood loss due to blood suckling activity result in anemia, normocytic normochromic anemia. Large number of hemorrhagic ulcers are seen in the intestine which indicate the site of attachment of worm. Diagnosis: fecal examination of egg, detection of anterior mesenteric aneurysm by rectal palpation, PM examination relieve aside emaciation and anemia. Treatment: febendazole 7.5 mg per kg body weight oral, thibendazole 440 mg per kg body weight oral, ivermectin 0.2 mg per kg body weight SC. Control: periodic deworming of horse, proper disposal, use clean posture. Chabertia ovina. Chabertia ovina morphology. This worm occurs in the colon of sheep, goat, cattle and other ruminant. The anterior end is curved, slightly ventral and the large buccal capsule open anterioventrally. Oral apparatus is surrounded by a double row of small cuticular element representing leaf crown. There is a shallow ventral cervical groove and anterior to it is a slightly inflated cephalic vessel. Male bursa is well developed with a gubernaculum. Life cycle. Life cycle is direct and infection of the host occurs by injection of infective larvae. Infective larvae go and attach to the mucosa of the upper colon and enter its wall. Then the larva develop into adult egg appear in the passage 48 to 54 days after infection. Pathogenesis. The worm attach themselves firmly to the mucosa of the colon by means of their buccal capsule and draw in a plug of mucosa of the glandular layer and digest the layer by their secretion. The adjoining part of the mucosa show an increased activity of goblet cell and infiltration with lymphocyte and eosinophil. The tapeworm appear to move about frequently, causing extensively destruction of the mucosa and thereby leading to bacterial infiltration. They also have a toxic application in severe infections, sheep loss, condition and become anemic and die. Postmortem lesion. Worms are found attached to the mucosa of the colon, which is congested and swollen with transparent mucus in several cases. Punctiform hemorrhages may be present. Diagnosis: fecal examination of egg, identification of larvae in fecal culture. Treatment: febendazole 7.5 mg per kg body weight, parenteral pomade 50 mg per kg body weight. Supportive medication may be necessary for severe case of diarrhea. Control: clean posture and periodic deworming. Genus Oesophagostomum. Genus Oesophagostomum. Genus Oesophagostomum. Morphology. The adult worms are 50 to 20 mm long. The female are larger than male. The head of Oesophagostomum worm has a prominent cephalic vesicle which may be constricted at several points depending on the species. The body of worm is covered with a cuticle which is flexible but rather tough. The worm have no external sign of segmentation. They have a tubular digestive system with two openings. They also have nervous system but no excretory organ and no circulatory system. neither a heart nor blood vessel. Male have two long rod-like spicules for attaching to the female during copulation. Oesophagostomum. Life cycle. They have a direct life cycle. Adult female lay egg in the large intestine of the host, which expelled out through the feces. In the environment, the egg releases the L1 larvae, which develop to infective L3 larvae in about 1 week. The eggs are susceptible to dryness and extreme temperature but can survive up to 3 months on pasture. Livestock become infected after ingesting such larvae while grazing. Ingested larvae penetrate into the intestinal mucosa and form nodules. About a week later, they escape from the nodules and migrate to the colon where they develop to adult and reproduce. In some cases, such as second-time infection, the immune system reacts to the larva, causing inflammation and encapsulation of the worm in nodule, which become infected with CG tissue secession. Oesophagostomum pathogenesis. The worms are very harmful for young cattle, lambs, and piglet. The massive infection can be fatal. The infective larvae penetrate the intestinal wall, react and form pea-shaped nodules. They disturb the physiological of the gut, cause diarrhea with mucous green or dark, disturbed peristaltic movement, affect digestion and defecation, which lead to enteritis. Secondary bacterial infection also occurs when the larva migrate across the liver or when nodules brush toward the abdominal cavity. Acute infection cause fever, loss of appetite, and weight colitis. Chronic infection cause anemia and swelling, edema in addition to diarrhea, which considerably weaken the animal. P-shaped nodule in colon of sheep. Pumply gut in intestine. Pumply gut in intestine. Pimply gut in intestine. Oesophagostomum diagnosis. Examination of fecal sample for detection of characteristic egg. Clinical sign by per rectum palpation of nodule. The nodule can also be seen in large intestine during postmortem examination. Pimply gut in intestine. Oesophagostomum prevention and control. Systemic and throat removal of manure can reduce the risk of infection. Antihelminthics such as benzimidazole, albendazole, febendazole, oxybenzole, etc., levomisole, as well as several macrocyclic lactones, doramectin, ivermectin are very effective against edelworm. There are so far no true vaccine against Oesophagostomum species. Biological control is so far no feasible. Genus Syngamus. Genus Syngamus. Genus Syngamus. Syngamus. Morphology. They are medium-sized worm commonly known as gap worm or red worm or fork worm. Male and female are joined together as a state of permanent copulation, forming a Y shape. Female up to 20 mm long are much longer than male up to 6 mm long. The worm have a tubular digestive system with two openings. The mouth capsule is cup-shaped and has up to 10 teeth. The worm also have a nervous system but no excretory organ and no circulatory system. neither a heart nor blood vessel. Each male has a bursa with two short spicules for attaching to the female during copulation. Syngamus trachea, Syngamus trachea, Syngamus in trachea, Syngamus life cycle. They have a direct life cycle with bud as final host and intermediate host for transport or paratenic host as earthworm, snail, slug, fly, and cockroach. Adult female lay eggs in the trachea of infected bird. These eggs reach the bird's mouth through coughing, exudation, etc. are slowed and passed with the feces. In the environmental infective L3 larvae develop inside the egg within 1 to 2 weeks. The infective larva stays by host the egg release the larva dead become encysted in the tissue and can remain infective for a year. Syngamus life cycle. Bird become infected through food or water contaminated with infective egg or after eating contaminated transport lost, earthworm, snail, insect, etc. Inside the bird, larvae penetrate the gut and reach the blood vessel. They are carried toward the lung along the mesenteric vein, the liver, and the heart. They reach the lungs about 24 hours after infection. They have mold twice. Shortly after the last mold, they copulate and migrate to the trachea where they attach to the wall to suck blood. Syngamus life cycle, indirect direct cycle. Syngamus clinical sign. The young bird are more susceptible to the infection than older bird. Clinical signs include coughing, sneezing, and respiratory disturbance. Initially, the bird tried to expel the worm vigorously, shaking their head. Later, they repeatedly gap and breathe with a hissing sound. They refuse to drink, lose appetite, and weight and become apathic. Anemia can also occur. In severe cases, death can happen, particularly in young bird. Syngamus pathogenesis. The worm can be very harmful, especially for young bird. They can be serious problem in free-range poultry, particularly if the bird have access to humid environment with abundant and intermediate host. A few species are usually well tolerated, especially by adult bird, which usually develop natural resistance if previously exposed to the worm. But in heavy infection, the worm causes inflammation of the wall of the trachea and increased mucus production, sometimes mixed with blood leaking from the small injury caused by the worm. Gaping movement, Syngamus diagnosis, examination of fecal sample and tracheal mucus for detection of characteristics. Diagnosis can be confirmed in young bird through direct observation of the trachea against a strong light. The adult worm can be seen inside the trachea. The worm can also be seen attached to the trachea in PM examination. Diagnosis, Syngamus diagnosis. The measures are especially important for young birds which are likely to be more susceptible to the infection. The bird bedding in poultry house should be kept dry. It is also advisable to restrict the access of free-range poultry to dark and humid environment where intermediate hosts are usually more abundant. The younger bird should be reared separately from older bird. The use of insecticide or molluscide to kill the intermediate host is usually not advisable. Use of pesticide is very effective way to control the worm. Thank you.